Dr. Hjalti Gudmundsson, he's a cardiologist, is here from Gundersen Health System today to talk to us about a new less invasive heart valve replacement for high-risk patients, and it's called TAVR. And we're going to show people a picture of it so they know what the valve replacement looks like. And as they take a look at this photo, why don't you give us an idea, what is it?
So TAVR stands for transcatheter aortic valve replacement for patients with severe aortic stenosis.
Okay, and this actually comes in different sizes depending on the valve size you'd need, but give people an idea what the disease itself is, aortic stenosis.
Sure. So aortic stenosis is the most common acquired heart valve disease and mainly affects the elderly. Once this valve becomes narrow or tight, people develop symptoms such as shortness of breath, chest pains, and even pass out. And at that time, it's time to intervene.
And unfortunately for that kind of the group we're talking about, a lot of times they're elderly and have other health concerns that maybe doesn't make them a very good patient as far as going into open heart surgery.
Yeah, so the open heart surgery is a great surgery and with excellent outcomes. However, about 30% of patients are not suitable for that, are either high risk or have multiple other comorbidities that sort of make them not a good surgical candidate. So now we can offer this procedure that is less invasive.
Okay, and this is really new. I mean, you've been doing this since May in our area. You've already had several patients, I should say, but give us an idea. We're going to show a video, and you can kind of tell people what we're seeing as far as how it works and why it's less invasive.
Sure. So this is a transcatheter aortic valve. Instead of doing an open heart procedure, we can go through the leg for the most part and sometimes through a small incision on the chest. Bring a catheter across the valve and have another valve on a stent that we can deploy in the aortic valve position.
And it literally pushes aside the valve that's there now.
Yeah, it's a stent and it crushes the old valve to the sides and has the function of a normal valve.
Okay, so this is one of those things, though, at this point, as you said, it's very new. So it's not something that's going to be widely available. This is for a very specific part of the population.
Yeah, the target population are the patients that are not surgical candidates because we know with experience that the surgery is a very good operation. However, this is suitable for high-risk patients or patients that we don't believe will tolerate open heart surgery.
Now, they can be a lot more delicate. So it's one of those things that, what have you been seeing as they've come out of surgery, you've had some really good results?
Yeah, a lot of patients get home, on day 3, day 4. They don't have the sternal wounds and feel a lot better immediately.
And so what are some of the things they're avoiding for these patients that they'd normally go through with the surgery that they wouldn't have to worry about as much with this kind of a procedure?
Well, the patients that have had previous surgery, bad lung disease or kidney disease, this is less time consuming and we avoid the big incisions and the healing of that. So recovery is a lot of times much faster, especially in the frail and sicker population.
Okay, we'll come back and check back with you in a few months to see how some of these patients are doing now that they've had this procedure. And Dr. Gudmundsson, thanks for joining us today too.